collecting things, I'd say probably my whole life. It started when I was younger, but it didn't really start getting bad until around the past year or so, when it started getting really bad. My mom always had a problem with keeping things and not wanting to get rid of things, and it's always been hard for me because I'm such a perfectionist. Like, I'm so worried that if I get rid of something that I'm going to need it one day, and it causes me so much stress that I just end up keeping it. But as far as it being a problem, I don't really think that I have a problem, but it does cause a problem as far as like my friends not wanting to come over, and it is obviously a little difficult to find things with the disorganization. I think that I feel the need to keep everything because, one, I'm worried that if I get rid of stuff that I'm going to need it later, and then I have other things that people have given me and I don't want to get rid of them because then I feel like I'm rejecting their gift, and just things like that. I don't consider myself as having psychological issues. I consider myself a perfectionist, and I don't really like giving away things that my friends have given me because I feel like if I give them away, then I'm being a bad friend. Because I'm a people pleaser, and I feel like if I give that away, that I'm disappointing the people in my life. And as far as my problem interfering with my everyday life, it doesn't interfere with my everyday life, but I think it interferes with other people's view of the everyday life because they don't want to come over and visit me, but I'm perfectly fine with the way my apartment is, and I don't mind if people come over with it being the way it is.
Hoarding, which is also called compulsive or pathological hoarding, happens when people who are commonly referred to as pack rats accumulate clutter in their house, which consists of items that they either don't need or never use or are broken, but they're unable to get rid of these items and it interferes with their everyday life. Scientists are unsure as to the specific cause of compulsive hoarding. However, recent studies have shown that genetics and family upbringing play a part. And also, PET scans of the brain have shown that damage to the right prefrontal cortex of the brain tends to cause compulsive hoarding. Hoarding is considered a subtype of obsessive-compulsive disorder and is most often treated with bipolar medication, antidepressant medication, and psychotherapy. Anyone can develop hoarding tendencies. However, compulsive hoarding usually starts around age 12 and tends to get worse as the person gets older. They're also more likely to become a hoarder if there's a family history of hoarding. Also, some people begin hoarding because of a stressful life event such as a divorce or a death in the family. Also, most people that are hoarders are also perfectionists because they feel as though they need to make the right decision about every item that they get, but trying to figure out what is the best decision just causes them more stress, and so they end up keeping everything so they don't have to make the decision.